Welcome, everyone. I'm excited to welcome you to this episode of the Sunflower Podcast, a podcast exploring all aspects of children's palliative care around the world. My name is Rachel Neufeld, and I'm thrilled to be here as a guest host for this podcast. I'm a pediatric palliative care nurse practitioner in Vancouver, Canada, working for Connect Place Children's Hospice. Here we find ourselves in Varanasi, and we are driving. So you're going to hear the sounds of the road as I drive with Dr. Pallavi Singh, a pediatric and adult palliative care physician in Varanasi. And while we are driving to a workshop today, we thought we would have a little conversation about her program. So welcome, Dr. Pallavi, and thank you for taking the time while you're driving to chat with me.
It's a pleasure all my hi. So today we are going to conduct a small workshop on pediatric palliative care, and that's all happened because Rachel is here. And so this is the first time we are conducting pediatric palliative care workshop in our institute. The institute is based in Varanasi in Uttar Pradesh. It is a unit of Tata Memorial Hospital, Mumbai, and the institute was started in 2018, and from 2021 onwards, pediatric palliative care dedicated OPD was functioning 5 days in a week. It started like that. So let's see how it goes today. So in this CME, we are including all the nurses of our hospital, then pediatric oncology team, and then all the other staff of the hospital are invited. So that the knowledge is shared with everyone and everyone get enlightened what we are doing and what we are missing and what can be done better. It's a shared views and discussion will go on.
So can you maybe tell me a little bit about how you got into this role of also including pediatric palliative care and maybe how that functions in your day-to-day world right now, how your job goes?
Okay, so I did my MD in palliative medicine, which include both adult and pediatric during my training. And I was interested in pediatric. I did a 2 Worlds Cancer Collaboration course, 1 year certificate course of pediatric palliative care. Currently, I am enrolled for the 2024-25 Leadership of Pediatric Palliative Care program also. So my interest grown up more. And when I completed my residency, I came back simultaneously, actually coincidentally you can say, this hospital of TMC Mumbai, one of the branches they have started building up in different cities of India. There are almost 7 now. So it came to Varanasi also, and Varanasi is my hometown. So I came back over here and joined the department. And then already department was started in 18, and I joined over here in 22 actually. So we were having the pediatric oncology, pediatric palliative care wing, but it was like not well established and it was not going every day in a week. So eventually, since the people were increasing in department and there was demand and the inflow of the patient was also increasing in hospital, so we started a dedicated OPD for pediatric palliative care.
So you see pediatric patients as outpatient department, and they are pediatric oncology patients. And then you also do some consulting for some of these patients that are also on the ward.
Yes, we do that, and we do admit some of the patient in our IPD patient also in our ward if they need admission for supportive care, for symptom management, sometimes for pain management, and often few times we have admitted patient for end of life care too. So,
and can you tell me a little bit about how you receive referrals and how you get connected to your patients?
So the referrals are basically given by the pediatric oncology team and sometimes the radiation team when they are seeing the child patient, or from the neurosurgeon if they are also managing some children patient for brain tumor. So these are the people who refer to us, and also the pediatric surgeon is like that. But the thing is that the referral usually come late. It doesn't start right from the beginning in our hospital. So recently, in my leadership program, which I told, I did a project on caregiver awareness and giving awareness to the other interdisciplinary team. So, what is pediatric palliative care? When they can visit us? What are the myths regarding this? So, this last 1 year, I did this, and now I saw that the referral pattern has been shifted a bit. They are sending patient for the other reason to us, and some are sent even early, but still lot of work still need to be done and go on. It's like that.
But that's good that you saw a direct impact of your advocacy work of trying to sensitize to the awareness of what it is and how it can help.
Yes.
And I imagine over the next years, as you do this job, your connection with your pediatric oncology colleagues will also grow, and they'll be more and more aware of the work you're doing and how to involve you. And I know you were saying yesterday too that the way that you are often introduced from the oncology team is to help with pain. And so when there's symptoms, you can be brought in not just for the awareness that maybe they're close to end of life, which I think is a positive shift as well, that you can start to do symptom management a little bit earlier in the trajectory then. What are you hopeful for if you think about the next few years of your program?
So the next few years, so now what I'm doing, that the awareness campaign which I did, I'm conducting an interview with some of the people to get the feedback, to know where we can correct and what was a positive point. And I'm going to present, I have put in this in our ethical committee also for publication. And I will going to present this to my DMG, which we say pediatric oncology team also. So this was the impact of this thing, and to sustain this thing, so it goes on. So what I'm going to do, I have pasted posters of pediatric palliative care, think of myth, do's and don'ts in the OPD waiting area in IPD and some few more areas that I have done. So that even I'm not able to do the awareness campaign, still the inflow continue. And since it is spread to so many people now, so they are aware and they are spreading. And I'm hoping that in future they also include us. I'm hoping that they include us for when they have a joint clinic discussion for any serious patient or any relapse patient, that we should be also included in that. And eventually, the referral pattern should be more better. It should be start from the beginning. That is another thing. And in child, we have to see the child. We have to take care of the parents, caregiver also. So they should not be neglected and addressed very well, including in every aspect, be it a financial thing, be their social, psychosocial concern, for everything. They should. Many times they don't speak. They don't come up. They are after their children disease and thinking of that only. But that point should be addressed and they should be asked. Something should be done. One more thing in future which I'm thinking, that bereavement call, which we are not very well established. We do, but we don't do for every patient.
Yeah, and I'm very happy to have met your clinical psychologist that you have as well on your staff in ways that can be helpful for those other pieces of family support, sibling support, maybe some bereavement support in the future, which I think is good to see interdisciplinary team that includes the nurses and the psychology support and things like that. So I wish all the best for the growth of this program, and we'll see how today goes with our short workshop to try and increase awareness and build the connections that you have with some of your colleagues to increase the referrals and how this program is run. So thank you very much.
Thank you.
I've now found myself in Kolkata and visiting the palliative program here at Tata Medical Center. And it's a beautiful set of buildings with a sprawling courtyard filled with flowers, trees for shade, and a fountain in the middle. Find patients and families sitting in this courtyard in the gardens, eating and waiting. It's a beautiful facility. And I had the pleasure of meeting with Dr. Shrikant as he did his rounds in the ward, as well as his outpatient department. He has a robust team of several medical officers along with 2 consultants. They support pain and symptom management and palliative care for both adults and pediatrics throughout this facility. They also have a 12-bed hospice near the hospital but off-site and is available for adults and pediatrics, although majority of the time the pediatrics stay at the hospital or go home with family. I did have the pleasure of meeting one pediatric family that was inpatient on the pediatric oncology floor. He was admitted for respiratory distress and had a severe relapse cancer. Dr. Shrikant counseled family, adjusted medication to make him more comfortable, and the team supported them and the parents to spend time with this boy at the end of his life on the ward. The last stop of this episode, I find myself at Dr. Gayatri Palat's doorstep in Hyderabad, where Two Worlds Cancer Collaboration and our Sunflower Children's Network has strong roots. She has a robust program in both adult and pediatric palliative care, covering hospital consultation, home care, and a hospice, with wards specifically for pediatrics, for adults, and for the geriatric non-cancer population. I had the pleasure of sitting down with Dr. Gayatri to talk through her perspective of the last few years of her program's growth and overall what is happening in India in terms of cancer control for children.
My name is Dr. Gayatri Palat. I am professor and head of the Department of Pain and Palliative Medicine, MNJ, Institute of Oncology. I'm also consultant to Two World Cancer Collaboration for Southeast Asian region to develop palliative care in general. And I'm also part of Board of Directors, International Children Palliative Care Network.
I've known you now 11 years, and I know you've worked with Two Worlds for many more years than that. I'm curious if you can tell us how your program has grown to include pediatric palliative care from where it started and maybe where it is now.
Thank you, Rachel. So, when I reflect on where we stand today, in my program, we have both cancer and non cancer palliative care services available for children with serious illnesses in Hyderabad and also across Telangana, the state of Telangana in India. And we have a hospital based program in a major tertiary children's hospital as well as tertiary cancer hospital, and in the community through hospice and home care in the city of Hyderabad and also across the district, all the districts. How this program evolved, if I reflect back, the adult program, which started way back in 2006 with support of Two World Cancer Collaboration, it grew exponentially because obviously the number is huge. And eventually the government took over, and now we have a full-fledged government supported program. Government owns the program. But while we are taking care of adult program, we used to get children with palliative care needs referred to us randomly. And then we realized that we'll never have, like, okay, I have achieved for adult, now let me do children. But whereas the priority for children palliative care is always low in a list of things when you plan any cancer program in a big way because the children number is very small.
Mm-hmm.
Realize that, but so we'll never achieve, okay, I've done with enough good with adult, now let's focus on children. It's never going to happen because adult number is so huge. So that's the reason we decided, like, unless we have a parallel planning to develop a pediatric program, we will never be able to do a very focused support to children and the family with palliative care needs. And that's how this program we developed way back in 2007. We started planning and the program started evolving. This is where we are today with a separate pediatric palliative care program.
I think it's one of the biggest, if not the biggest in the region in all of South Asia, isn't it?
I would say like biggest in number as well as the population coverage which we do.
Mm-hmm. And one of the things, so I had the joy of being able to sort of see it recently. And one of the things that I really appreciated too is that you have the opportunity for some continuity and following through through many different locations because you have hospital based programming, community based programming, and hospice based programming. So there's a really good opportunity to see a child through the trajectory. There were kids coming into the hospice for some symptom management, and home care knew them, and they would go back and continue to be followed by home care. They can go to the cancer hospital and get their treatments, or to Neelafur and get, neurology follow up or whatever it is that they needed. So I think there's something really beneficial about the fact that you have programming in all those different locations. Is there anything that you hope for that you want to see in terms of the future of your program?
I feel that what we are doing today is still tip of the iceberg,
Mm,
especially as regard to, I would say, both cancer and non-cancer, but more for non-cancer. It's a very opportunistic when we see a child in a children's hospital. Okay, this child may need palliative care. We are
mhm,
not done like it's absolute coverage. If we do it, this number will be like many folds more. So if only we can have kind of more like irrespective of where they are, if they have
mhm,
access to palliative care, that'll be great. So I would consider consolidating what we have so that
mhm.
more can have access to palliative care.
Well, I have no doubt that things will continue to grow and expand when you're at the helm of all of this. But also because you have your finger on the pulse of cancer diagnoses for both adults and children, but a large part of your programming has started from being based out of a cancer hospital. And in light of our upcoming Children's Cancer Day here, I'm wondering if you can maybe share with us the current state that you see of children's cancer care in India, and maybe some of the things you've seen change in the last 5 years, 10 years, where you guys have come from, maybe.
Yeah, absolutely. So I was looking at one of the very recent study by Indian study on data on childhood cancer. Like I said, it constitutes very small number. Like they say, 0.7 to 4.4% of total cancer in India. Childhood cancer, that means just less than 5% based on hospital record. And the survival, if you look at, okay, how many children, it's estimate only 4 to 5% of children they receive any cancer directed treatment actually in the community. Having said that, if you look at hospital based studies and the survival, it's a huge range they have quoted. 45 to 81%. That means in some hospitals, the survival is as good as like in any best resource
Mhm,
setup. They have
mhm,
survival. Whereas in many public hospital, I would assume because of various reasons, maybe it's 45%. So it's a huge
mhm,
range. So the what it indicates is that the hospital today in India are quite well equipped to treat children with childhood cancer. They have
mhm,
the hard options to do everything possible for a child with cancer, start for all the range of treatment from chemotherapy, radiation surgery, as well as bone marrow transplant. So most hospitals where they're treating children with cancer, they have this. I feel the problem is not that not having the facility. It's a more of a social issue. Children reaching late still for not getting the diagnosis properly closer to their home. They spend considerable period of time going around before they are diagnosed properly. And even if they start treatment, there's a huge treatment abandonment, and which is still a problem. So they
mhm,
don't get the treatment, and their baseline health is not good enough to withstand the treatment, and they succumb to infection. And those are the
mhm,
few things which is, I think, which is worrying, still getting the right treatment. But we are very hopeful things will change with massive awareness and both in the community among health workers, that the future of childhood cancer is improving because we still
mhm.
have good data about high survival in many hospitals.
And do you see that in India? Do you see that there is a growing communication for the community in terms of trying to educate, when to present to hospital, how to ask the questions about your child's health? Like, is that something that the government is also trying to expand on?
I would say, like a child, even in the most rural village, I would assume when they have simple thing like a fever, the
Mm,
parents take the child to the hospital. It's just that I think that hospital should be more aware, and which is happening, that do the right kind of investigation and
okay.
right direction as to where to go. They reach the right hospital without much delay. for fever, if they go around many hospitals before they reach the right hospital where they really need the right kind of investigation and treatment, if that
Mm-hmm.
delay is narrowed down, I think the picture will be much better, and which is happening. I'm very hopeful of that.
Yeah, I did have the pleasure of seeing a couple of different cancer hospitals in my trip there in India, and there's some amazing facilities and some really good care that's happening. So, we can continue to hope for increasing survivals and increasing the benefits of the treatment that they're getting. And in the meantime, your program continues to focus on the reduction of suffering of these children. Even just shadowing your team going through the hospital is that we have no tolerance for pain in these children. It doesn't exist. We're going to treat all their suffering, whether it's, physical symptoms or emotional or social, the family impact. The team I was able to witness looking at the whole picture of that child and everything that impacts their well-being. So I think that your program is also highlighting a lot of things for the hospital and the community in terms of how we can care for children in the best way possible too.
Absolutely, Rachel. There's so much we can do to help our children.
Well, thank you so much. I am very much looking forward to seeing all the things that you will accomplish in the next few years because you are forever expanding and improving. And thank you for all the hard work that you do.
So, thank you, Rachel. Thank you very much.
Thank you for listening to this episode of the Sunflower Palliative Care Podcast. These podcasts grew from a seed of an idea as we talked with our colleagues in the Sunflower Children's Network. The Sunflower Children's Network is an initiative of Two Worlds Cancer Collaboration, which focuses on children's palliative care. We hope to build a world where no child suffers from serious health-related issues. To learn more or to donate, please visit twoworldscancer.ca.